Welcome back. I am Savannah Sellers. I'm an NBC News correspondent. And every day at 1 p.m., I am going live right here to give you updates that you need and also some stories that you want to hear. Hopefully something that will make you smile, inform you, but not overwhelm you. That's what I say every day. That's my goal anyway. And there's quite a bit of news today, a lot to let you in on. I will try to not make it overwhelming and sort of look at the silver linings or the things that we can sort of learn from it or things that we anticipated. But yes, so here we are. For those of you who haven't been here before, every day live at 1 p.m. Eastern, we are doing this show, the updates that you need and stories that you also want to hear. And again, I'm Savannah. Nice to see y'all. Thank you for joining me. So every day I try to start with some good news because I know that that's helping us all out. Or it's helping me out anyway. Hopefully it's helping you guys out. And I know a lot of you have been messaging me saying that seeing these things that make you smile is sort of helping you out. So I'll make sure to include that. But starting with some good news, we had the lowest number of deaths in New York in more than a week. And it does look as though the curve is continuing to flatten. It does look as though we have flattened the curve. And so we're sort of in that. Right now it's not continuing to go up. It's flattening. We're not going down quite yet. It doesn't seem, but that's what health officials are saying cautiously. I think that the good news there is just that it does look like what we are doing is working, that we have some control over this virus by staying home, by sticking to those social distancing guidelines. So that's good news. In less good news, but something that is not entirely unanticipated, 5 million more people have filed for unemployment this week, which now brings that total up to almost 22 million over the last couple of weeks. That is, of course, a tough number to hear. It is a record-breaking number for unemployment, and I know that that is quite scary, but we were anticipating that this number would continue to go up, and part of that is because of the fact that it's been very difficult to file for unemployment because of this inundation that they're seeing, because of literally not being able to answer the phone or get back to people. So we were anticipating that number to go up, so it's not that it's a shock, but it just is that it's a huge record-breaking number. And that's part of that is also that when you're filing for unemployment, that means that you're able to get different types of help from the stimulus package if it looks as though you have lost your job or you have become a part-time worker. And I'll get into some of that stimulus stuff in just a minute because there are some pieces of financial news that I want to share with you. In New York, just a couple quick updates. I've been doing that every day because we're right after the governor of our state gives an update. And then also we have been, of course, sort of that first big problem area. And hopefully we remain the only one that is as bad as it is in New York. But it sort of seems like a good way to be an indicator for what could happen across the country and how and when curves will flatten in other places. Our stay-at-home order has been extended to May 15th here in New York. So if you're in New York, we're in this for at least another month. That is, again, not totally unanticipated. It had been set right now through the end of this month, about 2 more weeks, but it does not seem like we are in a place to lift that yet. Everybody does keep cautioning, all of medical and government officials keep cautioning that pausing that, or unpausing is actually what our governor is calling it, unpausing New York. Basically ending social distancing and going back to normal could just sort of mean we ricochet back into this mess and that the progress that we've made is not going to really mean anything. This is also happening in California. People are saying don't just talk about one state, totally, and I have been going through and updating about other states. Like, for example, in Michigan, one of the other things I wanted to tell you guys about the other day, I brought up that their governor put in a very strict stay-at-home order, which includes different types of restrictions on interstate travel. So just even within the state of Michigan, travel is being restricted. You can't move to a vacation residence that you own. You can't use motor boats, things like that. So there are people that are protesting in Michigan right now against that, saying that it is against their freedoms to be able to, to be told that they can't move within the state to a different home that they own. The idea there is that those areas where people really aren't living all the time, it's just seasonal living, they're not really equipped in a healthcare way if a bunch of people were to come there and then create more of a problem there. But there was a protest and people actually said they were going to be in their cars. They got out of their cars and the governor noted that that is not social distancing. So she was disappointed to see that. But that's something else going on around the country. Also, in a lot of these places, you've got to wear masks now. And in Pennsylvania, they're actually encouraging that businesses don't allow people into the business if they are not wearing a mask. So you cannot come into the grocery store or pharmacy or whatever it is without wearing a mask. So that is becoming more and more necessary across the country. And I've shared some ways, and I can actually share it on my story again about how you can make a mask at home. If you follow me at Watch Savannah, I'll link that on my Instagram account. Two of those big financial pieces of news that I thought that you guys might need to know that are a little stressful, but we'll talk through them. The small business loan program is officially out of cash. So the small business loan was part of this $350 billion that was supposed to be resources for suffering small businesses. They're not able to accept any more lenders or applications. They approved over 1.6 million loans before it was exhausted, and a lot of those people who were actually approved loans haven't seen them yet because of these bottleneck issues between agencies and banks. So the hope is that that will be extended, but now it's kind of going to come down to Democrats and Republicans working out what is going to be able to what more is going to be able to be provided for these small businesses. So that's on the small business front. Then on the checks front, your stimulus checks as individuals. I know we've been getting quite a few questions about that. A lot of people are very frustrated because the real issue here and the thing that we have to report is that people are getting their checks at different times. You might have a friend or even a family member who has gotten their check, but you have not. So some of the things that I wanted to just point out to you guys that I thought might be helpful for you in checking is that some people are thinking that their check is not the right amount. It's not what it's supposed to be. And that's actually because some people are confusing this stimulus cash check with just their normal tax refund. They're both being coded the same way when it comes into your bank account as tax ref, TAX_REF, tax ref. So people who were expecting a bigger refund or a bigger coronavirus payment are mistaking one for the other and then fearing that, they didn't get the money that they were supposed to get. So just make sure you can kind of check out which one that is that it's supposed to be. And the other thing to note is that a lot of people were just anticipating that they're getting the $1,200 check. You might actually be getting less than $1,200. You might not qualify for that full $1,200, and that money is based off of how much you make. So just make sure that you're actually anticipating the right number there. And then another thing that's being reported, and actually I've been messaging with a couple people who have come to me after this to say that they got their check, but it didn't include their $500 for their children. If you claim your children, you are supposed to be getting an additional $500 for them. So just that's something else to look out for. And then the unfortunate part of this, it's more than a little bit, it's very frustrating, and I totally understand that, is that this new IRS portal that is supposed to help you with tracking to see if you've gotten your money yet or to see when you're going to get it, it's not really working. By mid-afternoon yesterday, payment status not available was a trending topic on Twitter because that kept on failing, and that was that error message that people were getting. A lot of people were screenshotting these IRS website error messages. So hopefully that is able to start working out a little bit better. These are all new tools that are being introduced. This is obviously a lot of people, an inundation on systems of people who are wanting money or wanting to provide their bank information. So that's the other thing, is that I'll just quickly go over this because I get questions about this every day. For those of you who have been here and who have heard this, thank you, I'm sorry. But the idea is that you will just get this direct deposited into your account if you filed a tax return in 2018 or 2019 electronically, and then you received your tax refund via direct deposit. If you filed taxes the old-fashioned way, if you did it all on paper, then you will be having a check mailed to you. That you're not expected to get that yet. Those have not gone out yet. That would be in the next couple of weeks. So the direct deposits are what's happening now. And if you would like to input your bank information to get a direct deposit instead of a check, you can go to irs.gov, but that is where some of those issues are happening with this inundation of people using the system. So could be some delays there, but You guys can ask me questions on this. There's a lot we don't know, so I might not be able to answer, but I promise, as I did earlier in the week, I will keep bringing you information on this as we have it. One other piece of news you might need that I like to try to bring you guys every day, something that you can just be watching out for. This one's a little bit scary, but I just did read an account of somebody who this is what sort of helped her understand that something might actually be wrong with her father. So I just figured that it's important information for us all to have. COVID-19 might actually be affecting our brains in a way that we weren't really aware of before. There's growing evidence to suggest that this illness is actually affecting the brain and not just lungs, which is one of those big things we've seen, this respiratory issue where it's kind of like a pneumonia-like symptom, and that's why people are being put on ventilators and why that was the medical device that was so necessary for our hospitals to have enough of to be able to handle this big intake of patients. Now the brain too might be an issue. So a recent study of 214 patients in Wuhan, China, which is where this originated, found more than a third had neurological manifestations of the disease, including loss of consciousness or a stroke. And this woman that we reported on at NBC News that I mentioned, I read about and I thought it would be helpful for people to hear, was she first noticed something was up with her father, because normally he gets up early and he had showed no signs of dementia. He's 82 years old. Suddenly he wasn't getting out of bed until midday, and she thought maybe he was just dehydrated, but this does seem like this is related to coronavirus. If you also remember, one of the newest symptoms is that, or one of those kind of out there symptoms that was being reported other than just the fever and cough, was the fact that people are losing their sense of smell and taste, their ability to smell or taste anything. And for a lot of people, that's actually been going on for weeks, but it's not coming back, even though other than that, they feel better. They don't feel like they have coronavirus anymore. That now scientists and doctors are thinking that that might actually be one of those neurological symptoms, that it's affecting you in that way rather than that being, because you were stuffed up or something and couldn't smell or taste. It's actually a neurological side effect, is that smell or taste thing that we've been hearing about. So that's just something else to look out for. Another thing to look at when you are have family members who seem to be experiencing symptoms, something that could potentially be another thing, and stroke is now something that we think is associated with COVID-19, which is of course very scary. All right, if you guys want to start sending in any questions that you have, I've seen some of them. Somebody's asking, am I a doctor? No, I am not a doctor, but we have many doctors at NBC News who are reporting all of this out, which is where I'm getting my information and checking it with our medical unit. So no, I am not a doctor. I am not pretending to be a doctor at all. And every day, actually, when somebody asks me about getting tested or when they should get tested, I definitely have been saying, make sure you talk to your medical provider, call them, that type of thing. So no, I'm not a doctor at all. You guys can start sending in your questions. I want to show you a couple things to make you smile, since that is what I always try to do, so that we end on a positive note, and I have a couple today. So if you guys remember this 99-year-old war veteran, who by the way turns 100 at the end of the month, that I showed you the other day, this guy, he has been walking back and forth the length of his garden, his yard in the UK, so that to raise money for the NHS there, to raise money for healthcare workers, walking back and forth, and you could donate to him. His daughter started it. His initial goal was to raise £1,000. The other day I told you he had gotten up to about 2 million. He has now raised more than 13 million British pounds by walking back and forth in his backyard and people donating to him on turning 100 this month. That's so cool. One other thing that I thought was kind of funny that's going on, people are, or actually no, this is a really good one. This is a 106-year-old great-grandmother who has been released from the hospital after recovering from COVID-19. That's her right there. 106 years old. She's believed to be the oldest person to recover from coronavirus in the UK. I just love that. I think it gives us all some hope that, she can get through it, and hopefully, of course we all will as a society, but I know people who have, family members and such who are in the hospital. This is the tough time. So hopefully that can give you some hope. 106-year-old great-grandmother coming out of the hospital. All right, I'm going to start answering some questions, and I have seen some good ones. Let's see. Somebody asked, what type of hand soap works best? This is a good question. We haven't talked lately very much about hand washing, which is still very important. But what type of hand soap works best? Can we use non-antibacterial soap? That's a great question. And actually, yes, doctors and scientists are saying any type of soap is helpful. Any type of soap is going to get the job done. What really is killing the virus on your hands is you rubbing them together. The soap basically lodges into the virus particles that are on your hand. So it's really about you. That's why the 20 seconds and the warm water are really important, because the warmth also helps. But the 20 seconds are really supposed to make sure that you are getting all areas of your hand and doing it for long enough and, applying enough pressure. So yes, good question though about soap, and I'm happy to talk about hand washing again. Someone says, if you didn't file your taxes, can you still receive a stimulus check? That is a great question. I see another great question that I'm going to write down so I don't forget it. Is severe head pain. That's a great question about doing if you haven't done your taxes. So yes, that's where you can go and put in your information on irs.gov. Again, I want to stipulate that the website is having quite a bit of issues. A lot of error messages are coming in, but that's where you would need to go to input your bank information for that reason. And there are certain different types of things that if you still owe money, it's actually been said that if you owe taxes, you can still get the stimulus check, but there are certain things like having back paid child support that could mean that you might not get this check, or it's going to be a different amount than you had said. So look into what it is that your exact situation is. But if your issue is that the IRS does not have your banking information, irs.gov/coronavirus is where you can go for that information. And make sure that you are actually going to the URL yourself. Clicking on these different types of links is sending people to a lot of places that are spam, and they're hacking you, and it's not real. It's fraud, and basically a lot of people are being sent these places where then they're inputting their personal bank information, and then it's not actually going to the right place. It's not going to a safe place, and people are losing money. So make sure that you yourself are going to irs.gov and not clicking through on a link. Someone says, is severe migraine a symptom of the virus? And that is a good question. That's one I wrote down. Yes, headache has been reported as a symptom of the virus, but a lot of these things could mean that you have something else too. And I know that that's very frustrating to hear. I know myself, anytime that something is wrong right now, I'm like, what does this mean? Could this mean that, I potentially have it, or some type of mild case? But yes, headache has been one of the fairly consistent reported symptoms of COVID-19, but headache is also a symptom of a cold or the flu, or allergies for that matter. I know I get a lot of allergy related headaches, sinus headaches also. So a lot of these different things don't necessarily mean that you have it, but yes, that is within the list of symptoms. It is also within the list of symptoms of anything else. If you're asking that question because that's what you're experiencing, you should just take note of any of your other symptoms and talk to a doctor. Again, I'm saying this every day, but if you think you have any symptoms, talk to your doctor. And from there, the two sort of courses would be that you self-isolate and treat it yourself. So you actually treat the pain of the headache with like a Tylenol and acetaminophen, or that you eventually need to get tested, which your doctor would help you with if you do have symptoms that are lining up in that way. Someone says, how can I sanitize my belongings if I ran out of traditional cleaning products? That is a great question. And actually there are ways that we've been sharing at NBC News that you can create your own environmentally friendly, also actually, cleaning products. I'll link that on my page. I'm at Watch Savannah on Instagram. So after this live, I'll go into my story and add links to these different things that we discussed. But there is a way that you can create it on your own that is safe and effective, but also for different things like fabrics or your masks. If you're using a fabric mask, putting things through the washing machine is a good way to do that for that type of thing. But I'll link making your own cleaning product. All right, that was a lot of good questions. And again, I know I've been talking for a while, so I will go. If you have other questions, you can send them to me. I'm at Watch Savannah. Like I said, I've been answering them, and also that's sort of what's guiding me with what to discuss, because there's been getting a lot of somebody just said, this is a good question, I'll address this real quick. Can you please help people to understand you can still be asymptomatic and spread the virus? That is very important. Thank you for bringing that up, Oceans Angela. Yes, you can be asymptomatic and still be spreading the virus. That's actually the main reason for wearing the mask when you leave the house. Wearing a mask is so that you are not, the main reason for it, there's a little bit of evidence that it also protects you from getting it, but the main thing is that you are not spreading it. It's supposed to be helpful so that you are not giving it to other people. there is quite a large percentage of people who are testing positive for the virus that are asymptomatic. And that's because maybe they live with somebody, they're in a household where someone has it. So since they've been spending an extended amount of time, they're getting tested so that we can eliminate the number of people who are going out who might have it, who don't know that they have it. So you can be asymptomatic. You could have a super mild case of this and then not realize that it actually is COVID-19 and be spreading it just as potently as anybody else. So that is something to pay attention to. Anyway, if you guys send me questions or things you want to hear, I've been getting a ton of questions about the stimulus check, so that's why I've been covering it most days that we have new information to report for you guys. But I promise I'm looking and I am trying to address everything that you guys are sending me. Thank you for watching. I love talking to you guys every day. I love being on here. I'm live 1 p.m. Eastern every day on this account. I will see you guys tomorrow. Stay safe, be healthy. If you're sick, I'm thinking about you, and we will all get through this together. Have a good day, you guys. See you tomorrow.